the last two talks were very important because hearing a parent's perspective and we doctors are more used to talking than listening. My wife could tell me, you have a mic addiction. You want to get a mic, you're just not really good use. And it was important that we heard from the parents from there. And of course, one may have certain reservations of few concepts here and there, but ultimately I believe that what is not this pathy or that pathy, what helps my patients is good. As long as it's not harming, as long as it's taken in the right spirit and you are not misguided or you're not keeping a kind of false thing. So once you know what you're going in for, I think it's great. This meeting has been great, but I think the only thing is that it has been a bit topsy-turvy in the sense that I thought we'd finish by around 11:45, 12 and have a lot of question answers. We've come to 12:30, 12:40 and there has been no discussion. It means we just discussed for 15-20 minutes and we'll wind up by 1 o'clock, and it means that we have to meet again. Where there will be no talks, where there will be only discussion on various things, if you all agree with me. Because probably this is not, because apart from talks, actually discussing things one by one is important. But now I want to hear from all of you. You heard the talks. What are your comments, your experiences, your tips? I would like, all of you to share. Of course, our panelists will join us here for any questions that we have. And if you all don't have questions, I have a few questions to ask. So, Sir, Rajesh, Manjot, Amrita, okay. And Dr. Udare is here from Mahatma Gandhi MGM College. He is also involved in a lot of atopic dermatitis programs, educational programs. So we have a few discussions, but I would really appreciate any other comments or from any other parents. Mr. Chakravarti, you would like to say a few words? Yeah? You or Charu would like to say a few words or no? Come to the mic. You have to come to the mic. Because here, we need, everyone wants to listen to them. In the center there's the mic. Here there's the mic. Here. Sorry.
More than any questions, I think this has been extremely more than posing any questions. I think this has been extremely enlightening for both Charu and myself. We were exposed to this relatively late compared to some of the other experiences that were shared today. As if on cue on my son's 6th birthday a couple of years back, this kind of hit us, and we didn't know what had hit us. It was completely out of the blue. Perhaps we should have seen signs very early after his birth when there was a instance of a staph infection. Whilst he was still immediately after birth, but we didn't connect the dots. And then, as I said, immediately after the 6th birthday this happened, and progressively it got worse. We tried a whole host of things, mostly born out of ignorance, right from homeopathy to naturopathy to I think you made the right point that we listened to a lot of people, all well-intentioned, I'm sure, but not necessarily the right advice. We were also advised to go down the path of urine therapy, which was quite radical. We didn't try it, but I have to admit we seriously considered it. And I think as time went on, as time has gone on, we have learned to deal with it better. Our son is now at an age where he's in standard 2. He interacts with his classmates in a much more confident manner. Initially, I have to admit, whenever he had a bad breakout, he used to often ask us, why me? And I think we identified with some of those points that were made. And I think this is overall extremely reassuring. And we kind of accepted that this is perhaps going to be with us for the long haul. We all wish it isn't, but accepting the reality is the best way to deal with it, and that's what we're trying to do. With Dr. Shah's guidance, I think we're dealing with it much better. Our son is much more confident. Unfortunately, he can't take on some of the boy kind of activities like playing a game of soccer or he loves swimming, but we can't allow him to do so very regularly. But he's dealing with it. We're dealing with it. And I just have to say, you just got to be strong and be realistic about these things. There's no point getting down and dejected. You just got to take it on the chin and move on. And that's the best thing for your child's confidence as well.
Thank you.
I just want to have a comment. To what extent a person goes when the child is suffering. I had one friend of mine, I now stay out of public. I have come back to my old place and I met this fellow after so many years. And I was just trying to meet and say hello, and he said, no, he said, I'm too busy, I have to go somewhere and meet you other, I don't have time. So I was surprised, I met him after so many years of why he's Then, in the late evening he called me again. He said, sorry, I have to teach you something. But what happened is, he's a doctor himself. His child is suffering from atopic dermatitis. And he said he had visited some Baba. And he had told him that before 5:30, he has to go to a western sea, drop down a 5 rupee coin, a yellow flower, and a leaf. And it was almost 5:15. He had to go by 5:30. So as a doctor, as a parent of a suffering child, people go to any extent to do this thing. Fine, we do all those things, but then I think the message was quite clear. Keep one doctor who talks to you, who gives you a proper medication, understands the medicine, understands the patient, and definitely results are arriving.
Yeah, Maitri wants to say something, please.
Questions?
Yeah, sure.
First one, Manju, is for you. In pediatric atopic children, I at times have a slight bit of a dilemma. Differentiate bullous impetigo versus herpes simplex lesions. I mean, both can be vesicobullous lesions with honey crust, so I don't know whether, of course, the first line of treatment would be to give an antibiotic, but whether to initiate an antiviral also or not.
Generally, we can try with an antibiotic first, and because looking at the lesions, we can come to understand that whether we can get an idea whether it could be bullous impetigo or herpes, and then accordingly we can treat with an antibiotic. And if the patient is not responding, then maybe an antibiotic.
Yeah. So basically, this was a patient. See, what happens is, unfortunately, of course, this is more of patient problem, but it's a medical problem. But we'll discuss it briefly. Sometimes diseases don't read books, and they present very atypically. So that often happens, and we do not have a great microbiology backup. We don't have a great microbiology backup where we day one do take the fluid and send it across for a PCR or one of the things that or immunofluorescence that is required. So we have to rely and it was in her case, of course, it was a herpes simplex which looked very typically like impetigo, and that can happen.
Maybe it was
So sometimes if you are strongly suspecting, there is no harm in giving both together. Especially if there is atopic involved, there is no harm in giving both together. Of course, ideal thing is to do investigations and confirm the child.
My other question. See, like how childhood asthma is known to go into remission, or it kind of reduces in intensity drastically in a lot of patients. Is there any such hope for childhood atopic dermatitis to change or go into remission post-puberty?
We'll ask our experts first,
Yes.
one by one. What are their views?
I feel yes, more likely. Because what happens at puberty, there may be a brief flare at puberty where a lot of stresses come up. And at puberty, there's going to be little oiliness coming in. So definitely at puberty, most of atopics definitely improve. So there is I feel about that by puberty, but then still around 5 to 10% people may go what we call as adult atopics, which they tend to suffer.
We need the concept. So,
Because I agree with over a period of time it sort of gets milder and some people do overcome it. We've got a lot of patients who had asthma as a child, but as they grow older they get it.
Rajesh,
Look at the severity of the eczema at presentation. It is mild. Most of them, I think, go to the first 5 years of life and they tend to improve. It's been bad and severe, yes. It can persist for a long time and make them improve.
Yeah, I agree with Dr. Rajesh Thakur that mild eczemas do improve after puberty, whereas severe eczemas can persist even after puberty.
Amrita.
There's no hard and fast rule really that this is going to happen or this is not going to happen with every patient. It's very different, but mostly they do tend to improve, and then they always go through patches in life where there's also
But
So
in some
I'll come to the conclusion.
Yes.
So the point is that this is often earlier, 15 years back, 20 years back, one used to tell, don't worry, you won't outgrow the eczema. So outgrowing does not happen in almost 20% of patients, and 20 to even sometimes more. And now the incidence of eczema is increasing. There was a time when our seniors used to tell us there is no atopic dermatitis, and now any dermatologist who sees children will see that 20% of children who are coming to him or her are for atopic dermatitis. The incidence of asthma has also increased worldwide. So what happens is when we tell our patients, we can't tell them that you're going to outgrow. There are good chances that you may go into remission. There are good chances, but relapses are still possible. So it is better to under-promise and over-deliver, I would say. Because otherwise what happens is because they are holding your word in very high esteem. So if you tell them you're going to be alright and they won't get alright, they will be heartbroken. Okay. Now, I think we have time for one question. Lot of discussions were there. One thing that struck me very prominently was the thing about diets and eczema. So I thought I'll take our panelists' views on what their opinion is on elimination diets and how much to rely on all these tests that are done for food allergies, starting with Satish.
First of all, as far as atopic dermatitis is concerned, the diet causing atopics, the chances are very less. And it occurs, like I would address a question, so those atopics which have come because of the diet allergies come over it as the asthma, they will come over. Those who have got what we call as nowadays as an intrinsic eczema, there is some amount of genetic background, some amount of immunological background. These are the people who are going to go.
No, what is your advice to a patient?
So I was coming to that. I don't believe.
So you say that foods you eat every day.
They are going to come out of it because otherwise they are going to have allergy to milk tomorrow or today, nuts tomorrow, something else day after, and there is no hard and fast rule about the allergy testing done today.
Sir.
Manish, very frankly, I don't believe in any of these allergy tests because there is no relationship between the test and the individual. They are treating the patient, not the test. And most often you will see I said, how do you know the child is allergic to this? So yesterday morning the child had this for breakfast, and today he's got the eczema. Now we don't know that this is definitely, there's no relationship between that. If it has to happen, it has to happen within 2 hours, because food is digested in 2 hours, and it should manifest it upon that day. So I really don't believe that it has any bearing at all, especially in eczemas. I don't know how much about it's true about food allergies as such, and what symptoms those people show. As far as eczemas are concerned, it's got nothing to do with it. But if a patient has a belief and says, you know, I've noticed that X causes it, it's not, I don't have it. It's simple as that. If you tell the patient to have eggs, in spite of doing that, then, you know, psychologically it has tremendous effect, and they start believing that the eczema is going to get worse on the contrary.
Right. Personally, I don't advise most of my patients to be on any diet unless and until they have noticed the flare, or if the eczema, in spite of everything, is not coming under control, then possibly avoiding a few things like what she mentioned, like does. Wheat is one of those things which does in some patients, but otherwise, no. Manju?
Yeah, even in my case, if my patients do not respond to the therapies, that is the time I advise the parents to keep aware of the diet, especially the seafood like prawns, even eggs, wheat, peanuts. These are the 4 main foods which can cause flare-up of atopic dermatitis, especially in children and not in adults. So I tell my patients that be aware of this, and in case any one of them causes a flare, then maybe yes, they could avoid these food stuff in their children. Sometimes it's important for the patient, may not be important for us, but it's a very big part of our psyche that diet affects any disease. I sometimes just go ahead and tell them just to reassure them, and sometimes an allergy may even come. But as a rule, if a patient does want it, I do not deny them the test. I say, go ahead, do it, get it out of your system, get it out of the mind, get it done, put your mind to rest, and then see how.
So what I have to tell you is, Kavita wants to tell us.
So I can just.
Please come.
In my daughter's case, she exhibited allergy to dairy products when she was just 5-6 months old. So the first time I tried a cow's milk based formula with her, there was immediate redness around her mouth, neck, wherever the milk touched her skin, even if she did not ingest it. Her skin flared up and became red. So that was an immediate observation. So from the very first stage of infancy, I stopped breastfeeding her and put her on soy milk based formula. I could not give her cow's milk based formula. So that was an observed reaction. The same thing with peanuts. The first time she ate peanuts, she was wheezing, she could not talk. We had to give her antihistamine and then sit down with that. So whatever we have restricted as was based on those observations. We did allergy testing. We did IV blood tests, and 90% of what we tested for was positive as optical diagnosis. We tried eliminating some of the major food items that showed the highest level of reaction, like wheat and some of the other stuff. But food elimination based on the results did not help us. So we went back to, it was a nightmare 3-4 months where I could not give her wheat or dairy or nuts or anything because I didn't know what to feed her as a patient. But then we went back to including wheat and those other things. So all that we've eliminated from our diet is what visually I can observe gives her a reaction when she either eats it or she touches it. So that has helped us. So we have tried butter or cheese or any other milk or curd at various points in time over the last years, not just to see if she's up good. Every time she's eaten it, she has had the redness around her mouth. So I think last 2 months I have done.
So now what we...
Yes, for milk and peanuts they were very in the test. Very. Yeah. Total IgE was high. For observed allergens like milk products and peanuts, the testing also showed a high.
So the science is, now I'll take it in perspective. The science is that As it is, people who have atopic dermatitis do tend to exhibit allergies also, food allergies. Now that food allergy may sometimes be causing hives, urticaria, may sometimes be causing wheezing. Now, what the observation is that after eating a particular food, did the eczema become worse? And now the point is, if it is a food allergy, it has to be consistent. Means every time the food is administered, it should be reproducible, one, and it has to be timely. Means she noticed within a couple of hours a redness around that. That's very difficult. If after eating a particular food, there is tingling in the mouth, there is tingling within the mouth when you are swallowing, that's very, very suggestive of food allergy. And many a times the food allergy will not make the eczema worse, but hives may be happening, but when you scratch the hives, the atopic dermatitis becomes worse. So we need to take it in that perspective. And so what is done abroad is you do not rely on all these IgE tests because they may be falsely positive. Many a times you may be positive to think you have never eaten, so which may just signify an antibody response which has to be substantiated in real life. So what is the gold standard is something called as double-blind placebo-controlled food challenges. Means you in a doctor's chamber give. So there are these allergists who actually administer the thing and see what happens. So and then the diet is particularly restricted or not restricted. And even the data from those allergists shows that actual direct exacerbation of the atopic dermatitis by diet is not very high. But we need to take the totality into picture and you need to be aware. But blindly restricting a lot of foods does affect the child in many ways, sometimes nutritionally also. So we just need to take a balance. I think we have time only for this much today. I thank you all very much for having been a part of this. And we all also learned a lot, and I think we have a few comments from.
I just want to say one thing. Anamita mentioned it in her last slide. We are starting a support group for parents.
Yes.
In the 3rd week of July. It will be starting in my clinic. It will only be parents. There are no doctors involved. They can share their experiences. Because I think as the main caregiver, the mothers need to find an outlet.
Yes.
To discuss their problems or even just for emotional support. So everybody please feel welcome to join.
We should give it to all our patients give the option to all our patients. It sounds good. At least to me, I like to do it.
Yes. So like I said, it's completely for patients, it's to share their experiences and problems.
Couple of other things I think which we require somewhere down the line is awareness programs for schools. So that school actually I was going to discuss, but we don't have the time, what kind of a situation children with atopic dermatitis face in school. And I'm sure there will be stories from all of you. So we need to sensitize schools, the teachers, as to what this is. So right now I don't know, but I think there should be an eczema awareness walk. If we can just have how we have just a walk we can organize. So I'll get back to all of you when that comes through. That just raise awareness of eczema. I think that's all. Thank you very much. Thank you, sir, and thank you, Satish, Rajesh, all the speakers, the mothers. The personal touch here is what matters. Theory is nothing. Thank you so much.